This is a new MDM table which we are going to use in a 2021 only for the office visits. Okay, so this is the 3-column table. So this is a column 1, this is a column 2, and this is a column 3, which is further divided into 3 subcategories. Okay, so column 1 is nothing but code of level of service. Column 2 is nothing but level of MDM. So yes, we already know there are 4 types of levels: straightforward, low, moderate, high. 4 categories of levels. But to assign a level of service, still we need only 3 components out of 3, 3 elements out of 3, 2 elements out of 3. Okay, coming to the third column, which is elements of medical decision making. Again, it is divided into number and complexity of problems addressed, nothing but table A for our better understanding. Next one is amount and or complexity of data to be reviewed and analyzed. So this is nothing but table B. And coming to the third one, risk of complications and or morbidity or mortality of patient management, which is nothing but risk table or table C. Okay, if we can observe, there is no any conditions for table A or table B, table C. But coming to the table B, here we need to keep some attention to identify the category of table B. Okay, what are those? We'll have a look. Coming to the straightforward MDM, we need minimal from problem addressed, minimal or none from data, minimal risk of morbidity from additional diagnostic testing or treatment for 99202 to 99212. Coming to the low MDM, we need low. So when we can consider as low, 2 or more self-limited problem addressed, 1 stable chronic illness addressed, or 1 acute uncomplicated illness or injury addressed during encounter. So that is considered as low problems addressed. Okay, coming to the table B, here we need to pay some attention. So here limited, they are saying. So limited, when we can consider limited under table B, which is nothing but data table. So here we can observe 2 categories, category 1, category 2. So what is category 1? So category 1 talking about tests and documents. So to consider as category 1, we need at least 2 combination from this given data points. Then only we can consider that as category 1, and which is limited in data table. Or we need at least category 2. So what is category 2? Assessment requiring an independent historian. So either category 1 should met for limited data table, or category 2 should met. Any one is required to consider as limited data. Okay, coming to the risk, low risk of morbidity from additional diagnostic testing or treatment. So out of these 3, 2 tables is required to assign the 99203 or 99213. Okay, any 2 is required. Yes, coming to 99204 or 99214, which is moderate level of MDM. So coming under problems addressed under moderate category, yes, we can observe these are required to consider as problems addressed under moderate category. Coming to the devil, which is nothing but data table. Okay, here we can observe one more category. So category 1, category 2, category 3. But to consider as moderate in data table, the criteria will be same as low. So what is that? We need at least 1 category to satisfy as a moderate in data table. But coming to what are the different categories involved in moderate? So category 1, tests or documents or independent historian. Here we need at least 3 points to satisfy category 1. In low, we need only 2 points. But coming to moderate, we need at least 3 points to satisfy the category 1. Or category 2, independent interpretation of tests. Okay, or category 3, discussion of management or test interpretation. So we already discussed about what is tests or what is documents or what is independent historian and earlier slides, and we already discussed about independent interpretation of tests, and we also discussed about discussion of management or test interpretation in earlier slides. So any one category is required to consider as moderate under data table. Okay, coming to risk of complications, what is considered for moderate risk? Example, they given prescription drug management, decision regarding minor surgery with identified patient or procedure risk factor. So this is the new terminology that we need to remember in 2021. Okay, so next point is decision regarding elective major surgery without identified patient or procedure risk factors. So again, new point that we need to remember: diagnosis or treatment significantly limited by social determinants of health, which comes under moderate risk of complications. Okay, so this is the changes that we need to remember in 2021. Going forward, for high MDM, high level of MDM, so which comes under 99205 or 99215. So coming to the number and complexity of problems addressed. So what all considered under high category? Yes, we already know one or more chronic illness with severe exacerbation, or one or more chronic illness, one acute or chronic illness with poses to threat to life or bodily function is required for high problem addressed. Next, coming to the extensive under data table. So what is required to meet extensive data? So here also same three categories we can observe. So category 1, category 2, category 3. But the criteria is something different when compared with either moderate or low. So here we need at least 2 categories to meet for extensive data. So must meet the requirements of at least 2 out of 3. When we go and look at back in moderate, we need only 1 to consider as moderate. So for low also we need only 1 category, but coming to extensive we need at least 2 categories. Okay, so category 1, same, we need 3 points to satisfy the category 1, or category 2, independent interpretation of tests. So what is that? We already had a look. And category 3, discussion of management or test interpretation. So out of these 3 categories, we need at least 2 categories to satisfy the extensive data. Okay, coming to the risk of complication, which comes under high. So what they are given example: drug therapy requiring intensive monitoring for toxicity. So the social determinants of health will comes under moderate. The drug therapy requiring intensive monitoring for toxicity comes under high category. Okay, so decision regarding elective major surgery with identified patient or procedure risk factors, same. Some new terminology introduced. Decision regarding emergency major surgery, yes, we already know this. So decision regarding hospitalization. So this we need to remember. So decision regarding hospitalization is applicable for high risk of complications. Okay, so decision not to resuscitate or to de-escalate care before because of poor prognosis. Yes, this we already know, which comes under high category. So new points that we need to remember is decision regarding hospitalization and drug therapy requiring intensive monitoring for toxicity. Okay, so these are the points that we need to remember, which comes under high risk of complications. Okay, so with this I want to make you sure how we can assign levels in 2021 when compared to 2020.